Good morning. Today we'll talk about Patricia Benner theory. This project was realized by Ida Najem, Ivana Negrete, and Jennifer Cifuentes. We are studying nursing in University of Barcelona, Campus San Juan de Déu.
At the beginning, we will start explaining her biography and her career pathway. The biography. Patricia Benner was born in 1942 in Hampton, Virginia. She moved to California where she spent her childhood. The career pathway. In 1964, Patricia Benner ended her Bachelor of Science of Nursing from Pasadena College. In 1970, she realized a Master of Science of Nursing, and in 1982 she got her philosophy doctorate in the University of California. She became an international noted researcher and lecturer, and published 18 books. The most important of her books is From Novice to Expert.
To continue, we're gonna explain the Benner theory of skill acquisitions. What does it mean, skill acquisitions? Is the utility of the concept of skill acquisition lies in helping the teacher understand how to assist studying in advancing to the next level. If we come back, then Benner developed her theory as she attempted to articulate the knowledge nurse used every day in the practice setting. Patricia's work was first published in 1984. Benner's work, applied to the nursing profession, is adapted from the Davis model of skill acquisition. Here we have the 5 levels of capabilities that Dr. Benner did. The first level or stage is novice, where the person has no background experience of the situation in which he or she is involved, rules-driven and textbook-oriented. The work of Benner about the stage was the beginner have no experience of the situation in which they are expected to perform. In the stage 2 are advanced beginners, who demonstrate marginally acceptable performance. They emerge after learner has had multiple clinical experience. To finish, the nurses at this level are guided by rules and oriented by task competition. In the stage 3, belong to competent, where typically nurses have 2-3 years experience on the job in the same or similar day-to-day situation. And the plans are based on conscious abstract and analytic thinking. In stage 4, there are the proficients. This is a transitional stage, on the way to becoming an expert. They have more realistic understanding, improved decision making, and they learn from experience what to expect in certain situations and how to modify plans. To finish, we found the stage 5, expert, where the nurses have clinical experience and the skills increase, and they have an aptitude clinical situations. Benner did 7 domains of nursing practice. The one is helping role, the second is teaching or coaching function, the third is effective management of rapidly changing situations, 4. Administrating and monitoring therapeutic interventions and regimes, 5. Monitoring and ensuring quality of health care practice, 6. Organizational and work role competencies, and 7. Diagnostic client monitoring function.
Now we will continue with the four domains of nursing paradigm, which are nursing. She described nursing as an enabling condition and concerns. The basic terms are moral, ethic, and responsibility. The second one is person. She conceptualized the aspect of understanding that the person must deal with three roles. The first role are of situation, the second role are body, and the third role are person concerns. The third one is health. Benner focused on the life experience of being health and ill. Health not just being a absence of illness or disease. And the last one is environment. Patricia Benner preferred to use the term in situation of environment because a begin situation implies that one has a past, present, and future. Theory evaluation. Nurse develop and accumulate global set and paradigm about patients. Expert nursing use empiric, ethic, and personal knowledges. Benner support the practice and life experience.
To finish this project, we're gonna talk about critique of the model as a theory. We have two terms. The first one is called generality and the second is empirical person. We will start with generality. Benner's model contains concepts which are consistent with each other and are consistently utilized. And the second one is empirical precision. It was demonstrated using qualitative methods. There are elaborate 31 competitions, 7 domains on the practical nurse. Thank you for listening us.